Hello, I'm Dr. Ivanova at the Radiology department at the Medical University Varna. This is our English-speaking program, and this is one of the workstations that we proceed with our practicals. We'll have several looks at our patient for today. This is a patient with, as I was told, lung cancer. We see that this is the lung tissue setting. This is the lung window. We see well the parenchyma of the lung, and then we see this kind of consolidation that is located at the lateral part of the right upper lobe. You see that this is opacity. It looks white on the lung tissue window. And then we can go down and see that it is not very homogeneous in structure. So you see those air equivalent areas that they look dark on the CT. You see that? Those tiny dots that are darker than the normal. And you see that the border of this lesion, they're not very smooth and not straight. You see those tiny spicules that go out from the lesion. This is typical for the malignant tumors. They have those spiculated outlines in their structure. And we can go down and see whether there is any metastasis in this lung or not. Do you see anything pathological up to now? Do you see anything pathological at this lung field? No? Can you look at this? Does it look normal? If you compare it with the other side, it's very easy when you have two lungs. You have one right and one left, and you have to compare to see is there anything wrong. If you see something on the right side and you don't see it on the left side, then probably it's not okay. So you have some nodular lesion in the back dorsally at the right lung, which in this case probably is metastatic. And then we can proceed down to see if there is anything else wrong with the patient. Up to here, nothing. Now we have to turn to the soft tissue window to see how the lesion looks at the soft tissue window. Those are the adjustments for the CT machine to see very well the soft tissue window. You don't see the lung parenchyma, you only see the soft tissues. You see there is only dark here, whereas on the other one you would be able to see the normal lung parenchyma. And this is our lesion here, which is large enough. We have the option to measure the size. We usually choose the largest diameter, so let's say we do it here. And it's like 5.7 centimeters, which is larger. We can measure also the other diameter, which is again 5.7, so it's almost round. And we see that it is very in close contact to the chest wall, so you have to assess whether there is invasion of the chest wall or not.